Hi, my name's Leslie Meggs, and I just wanted to share with you guys a little bit about what I've experienced as a patient with AKI that then transcended into CKD, and kind of the lessons that I've learned from all of that. I wanted to try to give more than just a personal account of it, and try to be really open with you guys and candid about the things that I've learned personally as a patient from my experiences. So in the beginning, I was 8 years old when it all started. I had never been sick before in my life, always a healthy kid. I was very well read, and I was very busy with phone conferences all the time. And so when I came down with flu-like symptoms, my parents didn't think too much of it. So they took me to the doctor, and the doctor said it's fine. She just has a little fever. It's probably just viral. Take her home, let her rest. So we did. And this same cycle happened on and on throughout the day. We kept calling them, hey, her fever's going up. What do we do? Hey, she's not feeling well. She's vomiting. What do we do? Put her in an ice bath. Just wait it out. She'll be fine. And it got to a point where my mom had laid me down on the floor so she could change the sheets because I was throwing up everywhere. And she noticed these purple spots all over my body. And she had a heart attack. And so she called the doctor. Well, first she asked me, what happened? Did someone hit you? Have you been, abused? What is going on that I don't know about? And I was like, oh, I probably just fell at recess. Mom, calm down. It's not a big deal. And so she called the ER at the time because it was late in the night. And she told them, maybe I've seen too many of these psychological warfare movies where something's accidentally released into the air. But she's got purple irregular shaped spots all over her body. And this is just weird. And that's when the nurse said, oh, my God, you need to bring her in right away. She's dying. So I went to the ER. They did a spinal tap and put me on life flight on my way to Texas Children's, where I was diagnosed with Neisseria meningitis. And these are photos from my infectious disease physician at the time. I was in a double-blind drug study. So these are some of the photos that he used. And the last thing I remember after getting off of life flight was them putting me into a room in the ICU, everything really hazy, crying, asking them where my parents were, while all these gowned people surrounded me, held me to the bed, and shoved needles in my arms and legs, and tubes down my throat, up my nose. And you could tell that there was empathy there, but as a child, when you have no idea what's going on, it's very traumatizing. I was put into a medically induced coma for a month. I was intubated for that time as well. They brought my parents in many times to say goodbye to me. There was a point where I was practically brain dead, and they told them that there was no coming back and they might as well stop life support. Eventually, it got to a point where they finally were like, okay, maybe she will survive, but she's going to have all sorts of issues after the fact. She's going to have to lose her limb. She's going to have multi-system organ failure. She's going to be blind in an eye because I had one of the spots in my eyes at the time. And slowly but surely, I came out of the coma. I was still intubated. That is a very uncomfortable, situation for any of those who ever wondered. It's like breathing through a straw. And I had to learn how to walk all over again. They prepped me for the surgery to amputate my limbs. I went into the OR and came out with all 4 of my limbs. They were able to save them. I had to learn how to walk again. Everything slowly started coming back to normal except for my kidney function. So I was on continual dialysis throughout the time, and I slowly recovered. So everything was fine. My brain function came back, although I have a friend who disagrees, but it's true as far as I know. So slowly but surely, I finally was able to leave the hospital. And I had to come back 3 times a week, 5 o'clock in the morning at 8 years old for dialysis through a hemo catheter that was in my chest. Eventually, they were able to take me off of dialysis, and I was able to live a fairly normal life. Those are the open wounds from the surgery I was in. I had to go in and with a Q-tip because my mother is very intense and made me do it myself so that I would learn and clean it all out 3 times a day and change the gauze. That was excruciating. So after they removed the catheter, I was able to live a fairly normal life. And I spent my elementary, junior high, high school years acting and thinking like I was just like everybody else and I could have the same dreams and goals and desires and nothing would hinder, nothing would get in my way. And I was very determined. I was involved in every club I could be in. I was one of those annoying kids that had to be a perfectionist and everything. And it was about my junior year of high school that my nephrologist at the time said, hey, you know, I know things have been going fairly well, but we're at a point now where we're gonna have to do a transplant. And in my mind, I was like, I really don't have time for one because I'm about to start applying for colleges. Like, I have things to do. And so I ended up trying a low-protein vegan diet, which postponed my transplant for 2 years without dialysis. It was very difficult, and I had to do it when I started college. But I was able to get into college. My degree is in health communications and biochemistry, but it was not, and it still isn't, an easy road. But I am very involved in the kidney community now. I realized how much help our policy system needed when I was 10 years old, so I was at the Texas Senate. That's the speech that started it all. And then at the bottom left-hand corner, I was able to do an internship with a pediatric kidney camp and hang out with a bunch of kids who are around my age and see things in a new perspective. And we got to follow that up with doing, I did an internship in the organ harvesting process. So that was really cool. But for the most part, I have tried very, very hard to keep up a normal life. The medications have many, many side effects that I was not aware of at the time, that I had to learn how to learn again. I have tremors, I developed anxiety, all sorts of things. And that's why I think the kidney community, I think I have a picture during the lessons, yeah. This is a picture of Team Texas at the U.S. transplant games when we won the gold medal. So that was really exciting. But these are the lessons that I've kind of learned. Speaking of how community is so important. The very first lesson I've learned is how important communication is. How important it is for doctor-patients to have open communication, how important it is for patients to be able to communicate with each other, and how important it is for different teams within the hospital to be able to have open communication together. And as far as the communication between teams, that is very much out of my expertise. So I'll refer to my friends with the American Association of Renal Administrators to handle those questions, but it is very important, and it could be the matter of life or death in many, many situations. And as far as family and support systems are concerned, my parents were by my bed the entire time I was in critical care. There were a good number of mistakes that could have taken place from some of the medical teams that were there that they were able to catch because they saw every single second of my care. And so keeping an open mind and being willing to engage in that sort of way with support systems and with families is very, very important because they know more about that person than anyone else in the world at that point. Another lesson I learned is how important it is to have an environment of a community. It is the most powerful form of quality of life improvement, to be able to interact with other patients, to be able to interact with physicians on an equal plane, These transplant games that I've been a part of now for almost 10 years, you get to speak with other recipients who are on the same medications, other recipients who experience the same sort of things. You learn so much and you feel so empowered because you're not alone, because you go through the beginning of this entire process thinking you're crazy, because no one's telling you, hey, these are the side effects of this medication. Hey, it's normal to feel this way when you have no renal function. It's normal to feel depressed. It's normal to feel anxiety. It's normal to, to not want to get out of bed in the mornings because you feel like crap. You have somebody who's credible and you can share those experiences. And it actually, I've noticed, improves the adherence to treatments. Patients are more willing to listen to what you have to say and bring it back to each other and talk about it and kind of gauge where they are at together. And so creating some sort of form of a community within the patients and then also including the physicians and patients is vital, especially with a chronic disease. And I put it's applicable to all forms of the medical team because it is. So one of my favorite quotes is, when you've reached the end of your rope, tie a knot and hang on. Because one of the most important lessons that I have learned through my disease with my kidneys is resilience. And it has not been an easy lesson. I've realized that instead of running away from the past, I need to honor the past. I need to own it. And I need to claim it as my own. And I need to see it as the thing that has created the person that I am now. Sharing experiences of our stories is very empowering. And being able to, again, engage in that conversation helps the patients learn a lot, and I'm sure would help the physicians learn a lot as well, as you guys have mentioned today. You have to accept the present. It wasn't until, I want to say 4 years ago, that it finally hit me just how vulnerable my health is. It finally hit me that for the rest of my life, as of how medicine is now, I will forever either have to depend on another person's organ or a machine to keep me alive and functioning. And that is an overpowering feeling to come to that realization. And it takes time. It's definitely not an immediate realization. Mental health is incredibly important. And I want to be candid with you guys about this as well. I was at that same time diagnosed with complex post-traumatic stress disorder, which in my experience is incredibly common. And it has been a hard walk. When you go through these things in a critical care setting, it's not just the after effects of the disease that stay with you. It's the memories. And they're with you every day for the rest of your life. And that's something that you cannot get rid of. And I think that that's something that needs a lot more attention in the renal world. Because kidney disease obviously is a systemic disease, right? So it's going to affect every part of your body, including your brain. And it's very hard to recognize where you're at mentally when you've been sick for so long. And all of a sudden you wake up one day and you can't get out of bed. Everything triggers you. You can actually feel the tubes and the needles. And the amount of shame that comes with that and being able to own that is immense, especially starting off in college, being a perfectionist at the time, having lost control over my body from my health and then losing control over my body from my mind. It is probably the most humble experience, and being able to talk to patients about how that is normal and that is okay and there is help, and recognizing the early signs of that is vital, because patients aren't going to be able to share their experiences or share their advice or be able to participate in this entire process unless they are in a place where they can accept what's happened and they can own it and they can move forward and find the good to come out of it. Which leads me to functionality, because once you accept that, you can focus on what you do have, and you can focus on what you can do, because you can't change the past, you can't change the memories, but you can change your perception of it. And being able to stand up and get involved and have a conversation changes your perception so that finally, for the first time, you have some control over your body, and you have some control over your health, and you have a say as to what happens to you. And lastly, resilience and planning for the future. I always say that my health today is a direct result of my health yesterday, and my care yesterday, and my care 10 years ago, and my care 20 years ago. It all adds up to this and who I've become today. And keeping that in mind will propel so many patients to move forward, and I think physicians to kind of recalibrate just how important this very first moment is in a patient's care. As patients, we're not just survivors. I mean, we're warriors at this point. And being able to create that type of community and that sense where you move forward and you stand up and you keep going and you're involved and you are able to communicate clearly and openly will completely change the face of nephrology. We'll make it a household name so people know about it like they know about lung disease and heart disease and diabetes alone, and changing that entire outlook on it to make it more of a positive thing, like this is what it is and here's what we can do and here's how we're making it better. Being able to reach out in a public health way to communicate that will completely change the face of nephrology and the community as a whole. So Plato once said, I'm a quote geek, I really like quotes, that the beginning is the most important part of the work. The first step is the most important part of the journey. And that first step in this specific situation, for most people, belongs to you. Thank you.
That was great. So we have a few minutes for questions to recover from that very personal experience. Thank you for sharing that with us. I guess maybe I'll start. I have a question that comes from talking to some of my study patients, so some of the patients that have been enrolled in our trials, and sometimes the reaction that patients get, and I had one in particular who's very frank about this, is I just want to forget this. And you mentioned a bit about owning the past and all that. It's just the thing I wanted to do most was to forget any of that ever happened to me, and I want to get back to my life. And the fact that you're wanting to talk to me about getting my kidney function checked again, and the fact that you're wanting to talk to me about what my long-term risks might be like, is not something I want to hear. And so how do you react? I mean, it sounds like you went through that.
I mean, I'm still at a point, if I could forget everything that's happened, I would. I mean, it's a daily struggle, but I think it comes down to finding mental health support and getting to a point where you can accept it, because I mean, that's the first step in a long road. When you have a chronic disease, you either stay where you are or you move forward. And that's not as easy as it sounds. I mean, it's been, 20 years since my AKI, and I'm still just barely getting to a point where I feel kind of confident enough to do something with it. So, I mean, and that's normal, definitely.
Comments or questions from the audience?
So as I'm listening to you, I'm thinking, what can we do to get better patient engagement? So I think, when we look at kidney disease, if I look at pediatric populations and we have some of our pediatric colleagues here. With many pediatric diseases, parents are actively involved in working with the patient and the physician. And you see that those strong interactions. I'm an adult nephrologist. Many of us here are adult nephrologists. And kidney disease is really, in general, a disease of aging. We're dealing with an older population that, I guess, in many of our experiences are maybe less engaged. As you develop progressive CKD, as you mentioned, it tends to be silent. We, as physicians, we follow certain tests that we're aware of. Patients often have minimal symptoms until they progress into the later stages of CKD. And I guess as I'm thinking about this, what can we do to get better patient involvement and interactions with us? There are, through the National Kidney Foundation, I think they do a better job in probably engaging patients than the American Society of Nephrology. So for many physicians here, a major meeting, I hate to say this for the AKI people there, but the major meeting we go to is the American Society of Nephrology meetings. And as far as I know, I don't see patient engagement at that meeting. And I'm just thinking, what can we do to try to get better engagement for the renal community?
That was actually something that I forgot to mention, that I wanted to mention in my speech, is the transition from pediatric care to adult care, and the stark contrast between the types of care, because in pediatric care, everyone's your advocate. And a lot of pediatric hospitals don't really do the best job at training you to be your own advocate. And I think when you are ill, it's very hard to be your own advocate because it takes skills to know the types of questions to ask, to be able to explain things in a way that sparks people's interest. One of the things that we were mentioning at the KPMP meeting, just as an example of something that would gauge the patient's interest, is when you get a biopsy, turn it into a piece of art, give it to them, let them hang it on the wall, something that kind of creates a rapport on a very general level that anyone could understand. And I think medical translations, language-wise, is very, very important. I think being able to use analogies and kind of bring your words to a more lay public level, and like I said, kind of change the outlook of the renal community more towards a positive thing, an engaging thing, hey, you can understand this, and here's a community of people that you can go talk to about it, and we'll be there, and we can all discuss ideas, and the same sort of things that all these other organizations do with organs that make prettier things than pee.
Everything you have said, we have gone through. There's at least 4 of us or 5 of us who have had kidney transplants, okay? And we all have had our problems. I lost half my hearing. I have short-term memory loss, all because of the medications, okay? But we also have, a lot of us, we happen to run a support group here in Worcester, Pennsylvania. And what we do with patients that are in renal disease, we explain to them, we give them our stories, okay? And then we go in a circle and everyone tells their story. And then we have new patients that find out that they have renal disease. And they're like thrown into it, okay? They don't really understand it. When they go to a dialysis center and they start talking about different kinds of dialysis, they may have 1 session, maybe 2 sessions, and that's all they know. So they go into it basically scared, don't know what's going to happen to them. And so where our kind of group and many groups across the country do the same thing, we get them ready for it, okay? And that helps a lot, doing that. And we follow them all the way through dialysis. In fact, a lot of us will go to the hospital when they're called and sit with them, or with their parents or husbands or lives.
Mhm.
And, just explain to them what's going to happen. So we need more communications with the nephrologists also, because of a lot of nephrologists, and I'm not blaming anybody, but we have written letters to a lot of those people and don't get responses from them at all.
You guys.
Wanting to help, and we just don't get the help. And that's what we're here for. We're here to help.
That is fantastic. I think that is incredible. And in Houston, I know there's a few groups like that, but you're right, being able to reach out into the hospitals is difficult. You don't see it a lot. And that is definitely something that needs attention. That is awesome. You guys follow them all the way through.
We have 700 members and we have 10 locations.
Wow. Y'all want to come to Houston? That's fantastic.
Leslie, I was diagnosed when I was 11 years old and didn't start dialysis until I was 15. But unfortunately, the difference was you were obviously under a pediatric nephrology. I didn't have that. It was basically, I was under adult, considered adult, I guess, at that time. And you got kind of thrown into an adult atmosphere. So my question to you is, what is it like in that atmosphere of pediatric? I know my parents were told to take her home and treat her just like you treat the other children, which was good. But I was kind of curious of what that atmosphere is like when you are in a pediatric nephrology group.
Awesome. Everything tastes good and is colorful. No, my mom was a similar way. She had me reading my own lab work and making my own tests by the time I was 9 years old. So she was that way, and they really encouraged that. And I know that Texas Children's is working on that right now, creating kind of a side program to help people transition into adult medicine. And part of that program is teaching them how to become your own advocate, because you get spoiled a lot in pediatrics.
I think it's the spoiling part.
Yeah.
I was like you. I had nurses have to sit on me to put a nephrology, a tube in, and it's...
Well, it hurts.
Yeah, oh yeah. I have memories like you do, but like she had shared, it's important that you communicate even in the pediatric group with the young kids at their level. Talk to them. My mom and my dad wasn't there when they were dragging me into a room just to put a tube in, and I had no clue what was going on at that age, and it was scary. And I still have memories of the nurse sitting on top of me just to get the tube in, but I didn't understand what was going on. So communication is very important, even at a young age.
Definitely. Even with, if I could just add on to that excellent point, even preventatively, communicating about mental health, I think, is really important, because especially when you're a kid, going into adult medicine with these memories, like I said, you have no idea why you feel a certain way, and you just kind of take it that that's how life is. So being able to educate everyone about exactly what they're going into and exactly what they might experience is very, very important. I'll stop.
Thank you.
Mhm.
Thank
You're
you,
welcome.
Leslie.